The privilege this year of giving 3 commencement addresses in 1 week about 2 weeks ago. There's nothing like looking at the faces of the next generation of dentists and seeing the anticipation and excitement that they have upon finishing their training. And you know that feeling. All of us sat there, all of us know how we felt that day. But I had to think about what impacts them. And I was on my way to giving the first of those commencement addresses at Case Western Reserve. And on the newsstand was Time Magazine, and the cover article was on the millennial generation, and it was by Joel Stein. I don't know if you've seen that, it was a couple of weeks ago. And as I was on the plane reading this, Joel Stein says that the new generation of dentists, which encompasses the graduating class this year, are narcissistic, entitled, cognitive children, entitled as adults, all of the things that we've read in surveys, and that's why they'll be the next greatest generation to save us all. And this was the outcome of his article. And he goes through a whole variety of statistics in the article. He says, you know, the incidence of narcissistic personality disorder is 3 times higher in their generation than the baby boomers, which I was pleased to hear. But nonetheless, after all of the statistics he quotes in the article, his conclusion is actually where I expected him to wind up. And that is, you cannot measure a generation based on statistics and surveys and impressions, but rather by how they handle the challenges that befall them during their time in whatever profession they're in. And my message to them was, they are coming in at a time of relatively increasing professional challenges. An economy that's struggling to try foothold in recovery, increased government regulation, competing workforce models that are trying to expand scope into areas they just trained, more intrusive role insurance, exerting market pressures on all of us in our practices every day. Interestingly enough, I told them this is a critically important time for them to be engaged in leadership, to be engaged in the profession actively. They need to reconcile so many different things. They need to find answers to these challenges that we've never really seen before as a profession. They need to reconcile the diversity in the profession with the diversity that we're seeing in society. We're not there yet. We're making great strides, but we're not there yet. The burden of professional stewardship really falls on their shoulders. And I told them not to worry about the weight of it. It's just that somebody has to carry it. And their turn is arriving. Not quite yet, it's arriving. For now, it's our turn. So with that, what are we doing right now? Let me give you 3 areas that are game changers for the profession in the next 3 to 5 years. I used to say 3 to 5 years. I'm starting to say 2 to 3 years. And then give you 2 strategic initiatives that we have at the Board of Trustees this year. The first game changer, if you will, is an increase in consumerism among our patients. They're healthcare consumers now. They're coming in now with more information than we've ever seen them come in for. The days of having pamphlets in your office and educating the patients on the procedures that they need is really going away in favor of patients who can be informed, thoughtful, they understand what they want, they're consumers. This is changing the face of how we interact with our patients, and I think there are opportunities there. One of the opportunities is to educate them and be the trusted resource about what is right in terms of that information, because there's a lot out there. The Ad Council campaign that we've engaged in, the ADA is one of 36 organizations that invested an aggregate $4 million. In return, we'll get over $100 million and, public service ads by the Ad Council. And I don't know if you've seen some of them. But they run on specific channels that target underserved populations. You're not going to see these on the Golf Channel. You're going to see them in some markets, in some foreign language markets actually, where they're targeting underserved children. This is a critically important piece for us. Consumerism is changing the shape of reimbursements and financing as well, because patients right now are more vocal on the insurance side, and they're changing the way payers are looking at reimbursements and benefits for them and for their employees, for those that are ownership of their businesses. That's the first. The second is corporate dentistry, what we call corporate dentistry. It's actually not called corporate, it's actually dental service organizations. The emergence of dental service organization, we're talking about large, multi-state, 20-plus doctor facilities, primarily venture capital financed. That emergence, in 2009, they employed 2.9% roughly of the market share of practicing dentists. The expectation is by 2015, they'll be over 25% of practicing dentists. Now, this is a trend that's escalating. We need to understand a little bit more about it because you can't put all of these entities in one box. They're not the same. Let's just say our interest is there are members and non-members employed in those organizations that we need to reach out and find a value proposition for. That value proposition needs to go toward making sure that they have control of the treatment plan of the patient, that they never put themselves at risk by being subordinate to a for-profit corporate policy. That's very, very important. We can help them with that. On the other side of the coin, we need to help our states that are struggling with discussions about ownership of dental practice in the regulatory community. So that's what we need to do. And we're reaching out to try to understand them a little bit more. Massachusetts has been credited for the outstanding membership market share that we have here. Unbelievable. I started my career on the Council on Membership in 1980 something. And I can tell you that the effort that the Council on Membership in Massachusetts puts forward is really second to almost none. There are 5 states that not only gained membership in the last year, but also exceed the national average, which is 66.2% for all of us, the aggregate. We're at 80.7% in Massachusetts. There was a time that wasn't like that. We lost 3 percentage points between 2008 and 2009. We were going down, but what happened since then? The market increased by 87 members in 2011, 2012. We gained 151 members. We reversed that trend against all the odds and all the states going in the other direction. Massachusetts be credited for that. Let me just say that there are 2 things that we're doing right now on a strategic level. We had a retreat this year that, unfortunately for the board, I facilitated myself. We didn't hire a professional facilitator because I felt there was a time for us to start looking strategically at the horizon. We spend too much time as a board managing the business of the association and not enough time thinking down the road, what's happening on that horizon. What keeps me up at night is to think that one of the graduates today will look back and say, our profession and our lives could have been different if they had just found out this, or this, if they had paid attention to this, that, or the other. Some of you had the opportunity to hear Marco Vujicic, healthcare economist for the ADA. He presented at the summit this year. You'll hear him many, many, many more times because he's identifying trends that we need to pay attention to now. So with that, there are 2 strategic initiatives that the board has come up with right now. The first is member value and the perception of value of membership. That's something that we need to continually pay attention to, especially in Massachusetts. Because the last thing we need to do is look at the trends and say, well, it doesn't affect us. Because it will. And we always need to be vigilant on that. What's the value? What's the return on investment, return on objective that you get? And number 2, it's really about providing for the underserved populations. We have a new initiative out right now. It's called the Action for Dental Health. Too much of the access to care discussion is focused myopically on workforce. It's much, much broader than that. So we had a national press conference at the Washington Leadership Club, at the Washington Leadership meeting this year. We rolled out a very broad, sweeping initiative across the country to start to help those underserved populations. The statistics are alarming. 181 million people did not see a dentist in 2010. This is one of the world leaders economically. Why can't we provide for that care? 1 in 4 children has caries before the age of 5. Incredible in this country. Over 50% of people over 30 have some form of periodontal disease. We need to reverse some of those trends. So we have a broad initiative. You'll read a lot about that in the coming years. Let me just say that the only thing I know that I can tell you right now about the Affordable Care Act is it's a moving floor. And the simplest way to understand this impact on dentistry is 2 things, and I'll leave you with this. Look at it as 2 parts. The Medicaid side and the non-Medicaid side are health benefit exchange. Okay. On the Medicaid side, the law allows for the greatest expansion of Medicaid for adults ever. 84% by 2015, expected 21 to 25 million adults flooding the Medicaid rolls. Impact on dentistry, generally not too much. Utilization is down. Public services are down for adults because most states do not have adult Medicaid coverage, and that's a fact. The rolls will increase, doesn't have much of an impact on us. For children, utilization is up. First dollar in is always for children. We probably expect a 10% increase in the next 5 years, maybe a 3.2 million increase in children in Medicaid by 2018, next 5 years. That's the Medicaid side. On the health benefit exchange side, it's still in progress. For adults, voluntary purchasing of dental insurance, you think maybe 800,000 might, that's one estimate, might pick up dental insurance on the exchanges voluntarily. The negative side is we have some groups that are saying you can have 11 million adults leave their dental insurance because their children are now covered under the mandated pediatric bill. That would not be good. It would not be good for dentistry, it would not be good for us. More importantly, it would not be good for the public. On the children's side, we have a modest expected increase in purchasing insurance for their children because of the mandated pediatric benefit. There's still a lot to be determined on that. That's a simple way of looking at Affordable Care Act. Let me say I've spoken already at least 30 seconds beyond my 5 minutes. I know, don't tell me. Let me just leave you with the fact that it's been my greatest privilege serving as your president. Everything I've learned about organized dentistry, I learned right here in Massachusetts, on the councils and committees, on the board, and at this house. And it's a humbling experience. I want to thank you all for giving me the privilege to serve. Thank you very much.